I'd like to thank you guys, thank the library for having me tonight. I grew up in Dallas, and I have a lot of fond memories of going to the library, and I appreciate the opportunity to speak to you guys and share this information with you. Today my topic is preventing heart disease. Specifically, the main message today is going to be about how nutrition is key in the development of heart disease or cardiovascular disease, and then on the flip side then, how nutrition is key in preventing and reversing heart disease. Essentially, the message I'd like you guys to understand is we are what we eat. A little bit about myself: I'm a vascular surgeon, which means I operate on the blood vessels of the body. And I might do a bypass operation, or I might open up an artery and clean out the plaque, or I might do an angioplasty or a stent. I think it's such a common thing in our world today that none of you are strangers to this. Either you guys have had it done, or you know people who've had it done. So cardiovascular disease is a very significant thing in our society. So heart disease is also called, the medical term for it is atherosclerosis. And that is what we commonly know as hardening of the arteries. It's the buildup of plaque inside the arteries. So this is the artery, and this is just a cartoon or a drawing of the buildup of plaque, and you can see that this plaque is beginning to narrow the artery, and that will limit the blood flow of whatever that artery is supplying. And it's important to understand that the arteries are our interstate system of the body. They carry the blood everywhere. Without blood, our tissues and organs can't live. And the blood is it's everything. It's the oxygen, it's the nutrients, it's the white blood cells that fight infection. So again, when you can't deliver blood to our organs, the organs suffer. This is another, just some more drawings and examples I'd like you to understand. So why is this so important? Well, all of us in this room have atherosclerosis. Every one of us. None of us are immune to this. And it's, right here's an example or a drawing of an artery from a teenager. And right in here you see these little yellow streaks, or these are called fatty streaks. They start building up in our teenage years. And then this might be an example of someone in their 40s. This might be an example of someone in their 50s and 60s when they're beginning to really exhibit symptoms. And the reason we know this is they did studies back in the Korean War. When we had the Korean vets who were killed in action, they took 300 consecutive young men and brought them back and autopsied them and looked at their arteries. The average age of these men was 22 years old, okay, and 77% of them already had plaque in their arteries by this age. So we know from actual autopsy studies that atherosclerosis starts at an early age and then develops. It's a slow, indolent process that starts at an early age, it's progressive and it's silent until it causes a problem. And I might add that this was in the 1950s, okay? As bad as our diet has gotten now, the disease starts earlier. We now have imaging studies that shows the disease in 10-year-olds. And when I started my practice back in the late 90s, the average age of my patients was in the 50s and 60s and 70s. It's not unusual for me now to see someone in their 30s and even 40s. So it's starting to accelerate and it's getting worse. I put this in here just as an example to show that, this is an example of plaque building up in the artery to the leg. There's lack of blood flow down into the lower leg and foot area. And if someone develops a wound, it may not heal. And that's when I get called in to do a bypass or a stent. And if I can't save them, I'll show you some examples of what happens. This is an example of a normal artery and a diseased artery. And I bring this up to show you that the arteries in our bodies are actually living, breathing, physiologic organs. It's not just a tube, it's not just a PVC pipe. It has multiple layers. It has an outside coat, it has a muscular layer, and it has a very, very thin, you can kind of see it, it's a dark, thin layer here. This is called the intima or the endothelium. And the intima and endothelium, the reason I point that out is because it's extremely important in regulating what goes in and out of the arteries at various places in our body. So when we want to deliver protein or oxygen or nutrients or whatever the blood carries, it has to go through the intima. The intima actually regulates that. Glucose, for example, so we need a healthy, intact intima for good function of our arteries. What happens when we get a diseased artery, and this is the buildup of inflammation, fibrosis, and plaque. And this is the opening in the artery. Not only are we limited in the delivery of blood flow, but there's no intima lining this artery, so it ruins the functionality of the artery. The intima is also extremely important because it produces a very important molecule called nitric oxide. And nitric oxide is essential for the prevention of atherosclerosis in our body, and it's essential for the ability of our arteries to dilate. And we need our arteries to dilate in order to respond appropriately and deliver the blood flow at appropriate times. Nitric oxide is a very powerful vasodilator. It has strong blood pressure lowering effects. That's why as we get older and our arteries harden, we also get hypertension as well. And it's kind of a catch-22. When we get hypertension, it contributes to this, and this then contributes to hypertension. Nitric oxide delivery by the endothelium prevents atherosclerosis, but as we develop atherosclerosis and ruin our endothelium, we have less nitric oxide to protect us against atherosclerosis. It's essential for arterial health. So why is atherosclerosis so bad? I've already alluded to it a little bit. If you have blockages in the heart arteries, you can get a heart attack. If you have blockages in the arteries going to the brain, which is the carotid arteries, you can get a stroke, which is a brain attack. And there's something that people don't understand is that actually the most dementia is not due to Alzheimer's, but most dementia is due to vascular disease. What happens is that the small microscopic arteries inside the brain develop plaques and block off, and then we kill off very small areas of the brain, microscopic areas. But we're doing this over and over again as we age and as we get older, and then these areas become significant, and you basically have a confluence of microinfarcts or microscopic death, and it can lead to dementia. So the most common cause of dementia is actually cardiovascular disease, not Alzheimer's. Here's what I talked about earlier. This sometimes drives home the message. This is what I treat almost every day. And I'm sorry to throw it out there, but it does get your attention, doesn't it? These are two examples of somebody who has lack of blood flow to their foot, and then they developed a cut, a sore, a bug bite, or a scratch that then just grew because they couldn't heal. They couldn't deliver oxygen, they couldn't deliver blood cells, white blood cells. They couldn't even deliver the antibiotics they were given in their IVs to get down there and heal up. And this is what happens to those people when I can't restore blood flow to them. They lose their limbs. And then, here's another thing. People don't understand that most impotence is actually a vascular problem as well. 40% of men by the age of 40 have some form of impotence, 50% by 50, 60% by 60. And what happens here is that it's the arteries to our pelvis that begin to exhibit or begin to have blockages, and therefore impotence results. And this actually was highlighted when Viagra came out. And what Viagra is a powerful vasodilator. It dilates the blood vessels and allows more blood flow in the region, and thus curing the impotence. But we wouldn't need this vasodilator if you didn't have the blockages in there. And impotence is actually a very early sign of cardiovascular disease in men. Those men who are getting this by the time they're 40 should also be concerned that they have significant cardiovascular disease elsewhere. And not only does atherosclerosis lead to chronic debilitating diseases that cause pain and suffering, but the ultimate problem is this, death. Cardiovascular disease is the #1 killer of Americans. About 650,000 Americans die annually from cardiovascular disease, and that's just from the heart, and not the other things, and I'll get to that later in the talk. So how do you get atherosclerosis? Well, it's largely a lifestyle-related problem. 80%, maybe 90% of atherosclerosis could be prevented if we just paid better attention to our nutrition. Smoking is a significant contributor, but even though less Americans smoke today than in 50 years, we have more atherosclerosis than ever, and that's because our diet's getting worse and worse and worse. I do like to point out that genetics is not the problem. A lot of people think that because my mom had a heart attack or my dad had a stroke that I'm going to get it too, and that is just not the case. We all have similar genetics, but we turn on and turn off these genes in our bodies based on our environmental exposures. And the primary environmental exposure that we all get is our food. I mean, we all understand that environmental exposures such as tobacco or asbestos or plutonium cause problems, and we stay away from those, but we don't understand that the most significant contributor to our environment is our food. Cholesterol, saturated fat in processed foods, and the traditional American diet is extremely inflammatory. Most Americans are walking around chronically inflamed because of our diet. What does this do to the arteries? Well, they cause a direct injury to the endothelial lining, that intima that I was talking about. And when it gets injured, inflammation starts to occur right there, and then cholesterol and saturated fat deposit in that area, and a chronic process occurs. What happens, our body starts to attack itself. Our own white blood cells then go to that area of inflammation, and they try to engulf the cholesterol and the plaque. And what happens is that starts to lead to the buildup of plaque and inflammation in the area. And if you think about like when you cut your finger and it gets a little bit infected and how it might get swollen, well, that's what's happening inside our arteries, but it's not healing because we're chronically injuring it. Other things such as obesity, diabetes, and hypertension, all related to our diet, are other significant contributors to cardiovascular disease. So how does our current medical field treat atherosclerosis? Well, we throw drugs and surgery at it. And we like to do lots of procedures on people, and we like to give them lots of medications. And these medications are for life. We're not curing you, we're just treating a problem. And it might control your blood pressure a little bit, it might control your diabetes a little bit, but it's not getting to the root cause, which is our diet. Well, actually in 2016, our healthcare budget was $3.2 trillion. This year, it's probably $4 trillion. And they're estimating that by 2025, it's going to be $6 trillion. So we're throwing money and more money at this problem, but it's getting worse and worse and worse. And $6 trillion in 7 years is not, it's not sustainable. We can't do that. We don't have the money to pay for all this. These are stopgap measures. They do nothing to address the root cause of the disease, which is our lifestyle. So is there a better way to prevent and treat atherosclerosis? If I told you that most atherosclerosis is preventable, if I told you that it's also reversible, and that our medicines and our surgeries aren't doing this, but it's our diet. Being a specialist in cardiovascular disease, when I finished my fellowship in the late 90s, and I point out late 90s because it's important to understand the time frame, I was told that atherosclerosis was not curable. I was told it's slow, progressive indolent disease, and basically you have to live with it until you die, okay? But the reason I'm pointing that out is because here's some of the landmark work done by Dr. Dean Ornish, and he published this in 1990, okay? And that's what gets me, is even though I finished in the late 90s, I was still being taught what he had already disproved. And what he showed is, he took two groups of people. He took a control group who just continued to eat the standard American diet, and he took a treatment group where he put them on a plant, what we call a plant-based diet, which was a very healthy diet. It didn't involve it eliminated all the cholesterol, the saturated fat, sugar, oils, and salt from the diet. And in the treatment group, atherosclerosis actually reversed. In the standard American diet control group, atherosclerosis, as understandably, continued to get worse. And he proved this in 1990. He did the research in the late 80s and published this in the most prestigious medical journal in the world called Lancet. And despite this, 8 years later, I was still being taught that atherosclerosis wasn't treatable. That drives me nuts. Another one of our pioneers, Dr. Caldwell Esselstyn, is a surgeon who, from the Cleveland Clinic, actually was able to show that through angiograms that atherosclerosis is reversible. Here is the main artery that supplies the ventricle of our heart. Look at this, just after about 2.5 years, the disease is gone. He took heart patients who had been told they couldn't have stents, they couldn't have bypass surgery. They were basically given a death sentence. They were told they have less than 6 months to live because their heart disease was so bad. Okay, nothing could be done for them. And he took about 25 of these patients and he put them on a very good nutritional regimen. And 12 years later, 24 of those 25 patients were still alive. That's better than heart surgery, and that's better than stents. So what changes did these people make to their lifestyle? Well, the primary change was diet, and that's what I've been getting to you, is that today's talk is about how nutrition is extremely important. And what these guys did is they put their patients on whole food, plant-based diets. What does this mean? It's vegetables, fruits, whole grains, and legumes. Okay, And I point out here, green leafy vegetables are extremely important because they contain nitric oxide. Dr. Caldwell Esselstyn fed his patients 6 servings of spinach a day because of the nitric oxide in there. And I don't put anybody on 6 servings of spinach a day, but I do tell them to get 3 or 4 servings of green leafy vegetables a day. Okay, and these, but here's some green leafy vegetables that we, kale, Swiss chard, spinach, arugula, beet greens, romaine. I put beets in here. It's not a green leafy vegetable, it's a root, but it is very high in nitric oxide as well. These diets were high in starches like potatoes, rice, brown rice, whole grain pastas. It had limited seeds and nuts and minimally processed foods. 65% of what Americans eat today is processed foods. Okay, it's bad for you. What does a diet not include? Well, it doesn't include meat, including fish. It doesn't include dairy. It doesn't include eggs. Well, and let me talk to you about this. Meat is the primary source of cholesterol and fats in our diet. Okay, dairy is very high in saturated fat. Eggs, extremely high in cholesterol. Cheese is 70 to 80% fat. Most processed foods include lots of oil. They include lots of sugar. So we tell people to eliminate highly processed foods and eliminate salt and sugar from our diets. We're a sugar-addicted society, and sugar is not good for us. So thousands of studies have shown the hazards of the consumption of meat, dairy, salt, sugar, oil, and oil. Thousands of studies, yet we still haven't gotten the message. It has very deleterious effects on our organs and blood vessels. There are also thousands of studies that show the benefits of plant-based foods for our health. Yet there's not one study that shows the deadly effects of eating fruits and vegetables. Tell that to the meat and dairy industry, huh? It's very interesting. It took over 7,000 studies documenting the deadly effects of smoking before the Surgeon General actually put a warning label on cigarettes. And they didn't stop selling cigarettes, but they at least put a warning label in 1964. And that warning label did help, actually. That was the peak of smoking in the United States, and it has gone down every year since, okay? I kind of wonder when we're finally going to make the recommendations to our population that meat, dairy, cheese, eggs, and oil are deleterious to our health, and they need to put a warning label on those foods as well. We are a pill-popping nation. When people come to me, they want a pill or they want a procedure, but they don't want to change their diet. We're not addressing the underlying cause of these diseases, and it starts by changing the way we eat. There's an interesting cartoon, and Dr. Dean Ornish actually designed this cartoon, and it shows, he turns on a sink and puts a stopper in the sink, and it starts to overflow, and it shows 2 doctors mopping up the floor, and they're just continuing to mop up the floor and mop up the floor, and the water just keeps coming and keeps coming. So they're mopping up the floor, they're plugging holes and they're putting out leaks, putting out fires, but they're not addressing the root cause of the problem. So what does a typical day's menu look like? Well, it's minimally processed. You can still enjoy your favorites, but prepared in a healthier way. You can have tacos, pasta, pizza, chili, nachos, sushi, burgers, pancakes, waffles, salads, soups, and sandwiches. Just trying to eliminate the bad stuff and go with whole foods. And here's some examples of plant-based foods. Legumes, all sorts of beans, peas, lentils, garbanzos, the bulbs, onions, garlics, shallots, the flower vegetables like cauliflower, broccoli, artichokes, the green leafy vegetables like I talked about and I listed out earlier, the roots, whole grains like wheat, brown rice, rye, quinoa, millet. Mushrooms are extremely healthy for you, and then nuts. And I again point out that don't go overdoing it on the nuts, but limit yourself to 1 or 2 ounces a day. It's very interesting. Our society focuses on meat-based products, but there's literally only 6 or 7 different types of meats, and people forget about the variety of foods that are available to us. I think at last count there were over 3,000 documented edible plant-based foods. So here's some examples of some foods. Acai bowl, waffles made from whole grains, topped with fruits. I've topped them with fruits and berries and things like that without using syrups. I eat a lot of oatmeal, and I don't put sugar in it. I'll top it with sliced fruits and berries. Here's a cauliflower scramble, pancakes, a breakfast burrito. For lunch, One of my favorite foods, I eat a lot of potatoes. I find them filling, and I'll top them with vegetables or like a lentil chili. Vegetable burgers, sandwiches. This is a Buddha bowl. A Buddha bowl is another favorite of mine. It's usually got a grain in it, either quinoa or brown rice. It'll have some sort of bean or lentil, and then also lettuce, and topped off with some vegetables. Here's an example of a pizza minus the cheese. Stir fries, fruits and vegetables are good for snacks. I snack on oranges, apples, berries. Blueberries are my favorite. So I wanted to take a second to compare a meat-based meal to a plant-based meal. And so here on the left side is a plant-based, the nutrients in a plant-based meal and the nutrients in an animal-based meal. So start with cholesterol. 0 cholesterol in a plant-based meal, and 200 milligrams in a 500-calorie animal-based meal. The fat, we do get a little bit of fat in our foods, and we need fat, but we don't need 36 grams of fat. Protein, people are always saying, where do you get your protein? Well, a plant-based meal and an animal-based meal, the same calories, have essentially the same amount of protein in them. Plant-based eaters are not protein deficient. But this is very telling, fiber. We also aren't fiber deficient. We get plenty of fiber in a plant-based meal, but meat meals, animal-based meals, have no fiber whatsoever. And this is an important point. 97% of Americans are fiber deficient. We should be getting 40 to 50 grams of fiber a day, but the average American gets between 15 and 20 grams of fiber a day. So, and that's why we are riddled with colon cancer, as well as many other diseases. And then look at this: vitamin C, iron, calcium, beta-carotene, vitamin E, folate, and magnesium. Plant-based meals are just full of these vitamins and minerals, whereas there's very little in animal meals. And I might also point out that there's other essential items in plant-based meals that you don't get with animal meals, such as phytonutrients and antioxidants. And those are extremely important because antioxidants fight the inflammation in our body. We actually create oxidative stress in our bodies regularly, and we do more so with the standard American diet. And then phytonutrients are extremely important in fighting cancer. We are a cancer-riddled society as well. It's the #2 killer of Americans because we don't get enough phytonutrients in our diet. There's fiber in every plant food. It helps eliminate toxins. It's interesting that before the development of statins for cholesterol, we actually used to give patients a fiber-based pill to take to try to reduce their cholesterol. And that's gone by the wayside because statins have been developed. But fiber binds cholesterol and fats. It also binds toxins that we get on a daily basis in our meals, and it helps us pass them out without them being absorbed into our body. Fiber also helps us feel full and satiated. They're also important prebiotics, and prebiotics are basically the fiber feeds our healthy gut bacteria, and that's important for good health. The gut is probably one of the most important organs for our immune system and our overall health. And it's the gut bacteria that live in our intestines that are a part of that. And so we need healthy gut bacteria. And you get none of this in animal products. So I want to show you this slide, and this talks about the calorie density of foods. The average American eats 3 to 5 pounds of food a day. This line kind of separates plant-based foods over here versus mostly animal-based foods over here. And if we spend most of our time eating these foods and we're eating 3 pounds, we're going to get a lot of calories in the day. But if we concentrate on this side, we can eat 3, 4, or 5 pounds of foods, fill ourselves up, and still not get that many calories. So actually, I tell my patients, if they switch to fruits and vegetables and legumes and beans and stuff like that, they can eat till they're full, and they can eat regularly, and they'll actually not only will they not gain weight, they'll probably lose weight. Most people on a healthy plant-based diet achieve a very good, stable, healthy weight. Another way to understand that is take a look at this. This is 400 calories of oil, which is literally only 3 tablespoons. So it doesn't really fill your stomach up, and it doesn't make you feel full. This is 400 calories of cheese. This is 400 calories of animal products. So none of these fill you up, and you're going to want to keep eating to feel satiated. Well, here, look at this. This is 400 calories of beans, grains, and potatoes, and 400 calories of fruits and vegetables. You can eat a lot of these foods right here, get full, and feel satisfied and not be eating a lot of calories, not to mention that it's healthy calories and not bad calories. I also wanted to spend a second talking about carbohydrates or carbs. Carbs have been demonized in our society. So a plant-based diet is actually a carbohydrate-based diet. It's about 70% carbohydrate, 65 to 70% carbohydrate. And the problem is there's a difference between a good carb and a bad carb. And this slide helps show it. On the left side are good carbs, on the right side are bad carbs. This is candy, soda, pastries, sugary cereals, white rice, white flour, and white breads. And those are bad carbs, and I tell people to stay away from them. But there are good carbs, and these are the ones I tell people to eat all they want. Fruits, green leafy vegetables and vegetables, leafy green vegetables, starchy veggies like potatoes and sweet potatoes, beans, lentils, peas, whole grains, brown rice, quinoa, oats, corn, pastas made from whole wheat, brown rice, lentils, beans, and chickpeas. Carbs, you need to understand that the carbs are good and just got to eat the good carbs. So is making a change from the standard American diet to a plant-based diet tough? It can be, and I don't tell people to go into this unarmed. I say do your research, get informed. Obviously there's a lot of habits, traditions, culture, and social pressures in our society that take you away from eating healthy. A good social support system and information is important. That's why Maya and I do what we do. We're trying to get the word out, we're trying to help people, and we're trying to create support systems for you. Again, like I said, do some reading, research on the internet, watch documentaries, and the resources are out there. Most of what we learned about our diet is from TV and advertising. Got Milk, the incredible edible egg. I think this one's interesting. The egg industry tried to put out ads saying that eggs were healthy, and the FDA specifically told them they couldn't do that. And that was the biggest favor the FDA could have done for them, because instead they came up with a jingle that probably sold more eggs than if they told them it was healthy for them. This is interesting too. How many of you knew that processed meat is a carcinogen? It's not too many, right? Well, this came out in 2016. The World Health Organization classified processed meats like bacon, sausage, hot dogs, and deli meats as a class 1 carcinogen. That doesn't mean there's some association. That means they cause cancer. Okay, it's been proven scientifically in hundreds and hundreds of scientific articles, processed meats cause cancer. It's class 1 carcinogens. You know what else are class 1 carcinogens? Asbestos, plutonium, and tobacco. And I like to use this example. If I passed out a spoon of powdered asbestos and asked any of you guys to put that in your mouth, would you? No?
If it tastes like bacon.
Right, yeah. Just disguise it as bacon and we can sell all that asbestos that we've been taking down. Or if I asked you to sleep with a nugget of plutonium next to your head at night, you wouldn't do it. And we continue to feed this to our kids in schools. Is that crazy? Kids get deli meats, they get hot dogs, they get pizzas with pepperoni on it. It's amazing to me. Today I read an article in my own Dallas County Medical Society journal, and there was an advertisement from a meat supplier in that. And I'm going to go file a complaint with the Dallas County Medical Society on that when I have time. The reason we still do it is because of we don't know. And we're bombarded on a regular basis by all these advertising and social pressures, but the general public just doesn't know. Just like very few of you in here knew that meat causes cancer. And the reality is no one's getting rich from you guys eating a potato or a bowl of fruit. Okay? They don't want to sell you broccoli or asparagus. They want to sell you meat and dairy and processed foods. Why is a vascular surgeon here talking to you about this? And I had a twofold path, a personal path and a professional path. Personally, I've always been in search of my own health, and I've exercised, I've run regularly all my life, I've lifted weights since I was a teenager. I always thought, just like all of us, that I knew what was right and I was on the right path. And part of that was, as I learned in my 40s through a exercise program that I did, P90X, is that Tony Horton said that 80% of the game was nutrition. And so I really focused on my nutrition in my 40s, but I still wasn't doing it right. I was going for a high protein, low fat diet. And I was in shape. I had low body fat percentage. I could run for miles and miles and miles, and I thought I was healthy, but there was signs that I wasn't really paying attention to, that I wasn't in the best of health. And this is in my 40s. My blood pressure was borderline high. It was in the 130s. At that time, that was considered normal. Today, that would be considered hypertension because we've changed the recommendations. My blood sugar was always borderline high. My cholesterol was over 200, and my triglycerides were borderline. So despite me exercising and lifting weights and eating what I thought was a very healthy diet, I had the signs or the beginnings of lots of diseases that would have continued to progress had I continued to be that way. About 5 years ago, Maya drugged me to watch a guy talk at Whole Foods his name was Rip Esselstyn. He's the son of Caldwell Esselstyn. And he caught my attention, and then I went on to read a book called The China Study, and then that book by Caldwell Esselstyn called How to Prevent and Reverse Heart Disease. And then I saw a documentary called Forks Over Knives, which I would recommend to everybody. And these things started to impact me, and I read the work of Dean Ornish, and I was floored because I suddenly realized that I could do something. I never thought about how my health was so strongly impacted by the foods I was eating, and I could change that. So when I did become plant-based, it only took 4 months for my blood pressure to normalize, my blood sugar to come down, my triglycerides and my cholesterol are well below normal in just 4 months. And that's a testimony too to the fact that we can be taking medications for years and they don't do anything. And in just 4 months, and I would venture actually even less time on a healthy diet, we can correct a lot of these problems that we're causing in ourselves. The reality is just within a few weeks these changes occur. And what I tell people is the body is a magnificent machine. It wants to be healthy. It can heal itself. Okay, we actually are chronically having cancers that are popping up in our body all the time, and our body snuffs those out. Okay, and one of the problems we're doing with an animal-based diet is we are promoting these cancers and to the point where our body can't snuff them all out, and that's why cancer is so rampant. But if we stop injuring our body on a daily basis with this animal-based diet, not only would it come back to a zero baseline and then start eating a plant-based diet, we actually become healthier and we allow our bodies to heal. I give an example that it's like taking our thumb and hitting it every day with a hammer. It's not going to heal if we do that. And what we're doing is we're hitting our bodies with a hammer every day with an animal-based diet. And by taking that away and eating a plant-based diet, we allow our bodies to heal, and they heal amazingly quick. There's the sink with the water overflowing, and here's a couple of doctors who all they're doing is just mopping up the floor. And that's what we're doing with our healthcare system. The professional path is that once I realized this about myself, I started preaching this to my patients too. At the same time, Maya and I have decided to try to get this message out, not just to my patients, but to the rest of the public. And we've joined many other people in trying to, and making this a mission to where we can try to, how about make America healthy again, right? So I'm going to start wrapping this up. I'll put this in a pretty little package for you. There's 650,000 cardiac deaths annually. There's 140,000 strokes annually. And I treat a lot of stroke patients because I operate on carotid arteries. My patients tell me they'd rather die than have a stroke and be bedridden and have somebody clean up after them and have somebody have to feed them or be on a feeding tube. There's 200,000 amputations annually. That's 1 million right there, 1 million problems right there just from cardiovascular disease. Dementia is in the millions. Impotence is in the millions. And I didn't even talk about kidney failure today. Cardiovascular disease is the #1 cause of death and disease in the United States and the world, and it's getting worse because our diet is getting worse. After our 50s, we're now, as a society, busy dying rather than busy living. My patients in the last 15 to 20 years of their lives are miserable. They're in and out of the hospital regularly. They're spending all of their retirement money. They're not enjoying their lives. When at the point in our lives where we would want to try to enjoy our lives, we're not. We all have atherosclerosis to some extent due to our diet and lifestyle, and now that you know, what are you going to do about it?